We are ready for our next speaker. As mentioned, we will be taking questions after both of our speakers have had a chance, and so our next speaker is the Honourable Health Minister, Mr. Fred Horne. Mr. Horne, if you would.
Well, thank you, Dr. Maybaum, and good evening, ladies and gentlemen. Good evening, doctors. And I want to begin by thanking CAMS for the invitation to come here. It's actually an invitation that was extended some time ago, I believe shortly after my appointment as minister, a little over a year ago. And I had attended, I think, meetings with previous ministers here in the past, and I had always enjoyed the opportunity for some discussion with our physicians about the issues in our healthcare system, but also about the opportunities for the future, which is something I want to spend a few minutes talking about this evening. So I had a bit of I guess I have a bit of a story in terms of how I got here tonight as well. It all started, and my two legislature colleagues will empathize with this, it all started a little over a day ago, and I think the three of us, I know I certainly have been up for the better part of 36 hours now. The legislature sat all night last night and is continuing to sit this evening. So I was very much concerned about the weather. I'm glad to be here this evening. I was invited for dinner. It occurred to me on the way down here that I might be dinner. And so far that hasn't been the case. But I do want to thank you for the invitation to be here. There are a number of things I want to say tonight, but before I do, I want to make a few observations. The first is you will not hear me attribute a personal motive or characterization of anyone this evening, including your leadership or any of your members. I don't believe that's what this discussion is about. That said, I recognize the frustration that is evident in this room and that is evident among physicians. And we'll talk a little bit more in a minute about how that came about, and I think Dr. Giuffre has done that. But I will not engage in a sort of freewheeling attempt to interpret or characterize or, as I said, attribute motive to anyone. I don't think that's my role. I recognize that the role of the president of the AMA is to represent the members of the association, and that the association exists to advance the interests of its members. And that's well and as it should be. My role as the Minister of Health is quite a bit different than that. The constituency that I represent are all the citizens of Alberta, in addition to my own constituents. I also have the responsibility of working with and trying my best to serve the interests of all health professions, and with, of course, physicians being one of the most important. Certainly from the patient perspective, the most important profession in our system. And so with that in mind, I guess the other observation I'd make before I get started is that it was not my understanding that media were going to be here tonight. I don't have a problem with the fact that they are, but because the desire is to talk about the negotiations and where we stand, I am going to be somewhat careful here, because as I think any of you who know me know, I firmly believe, and our government firmly believes, that it is in the best interests of Alberta and Albertans that there is a strong agreement between physicians and the government. And I have absolutely no doubt that we will be successful in reaching an agreement. I think the question today is how we get there. And I think, for what it's worth, I think Dr. Giuffre's rehashing from his perspective, from the AMA's perspective, of the last 20 months is helpful. And I will give you a bit of perspective from the government's point of view as to how we got here as well. So that's a little bit about how I view the opportunity this evening, and I will do my best to answer your questions. But I will be speaking on the assumption that we will be having negotiations in the future, that eventually there will be an agreement, and I will not jeopardize the integrity of those discussions by speaking inappropriately about those details in front of the media. So I'm going to be very frank with you about that up front, because I believe that respect for the integrity of the discussions is absolutely critical to our success. Now, when I accepted the invitation to attend some time ago, I thought I would talk about the issue of sustainability in public health care. And I'll say a couple of words about that, just very brief words, but it might help give you some perspective as to how government looks at the issues. And again, I appreciate that the purpose of the AMA is to represent the interests of its members, and that is a different perspective than I am charged with in my role as your health minister. So, sustainability it's a big discussion across the country today. Most people like me, most people who are elected, and for those of you that don't know me, I spent pretty much my whole career in the field of health policy, about 30 years. So I've had an opportunity to think about some of these issues prior to running for elected office. But most people in public life talk about sustainability in healthcare in terms of the percentage of the provincial budget that is going toward health. And in Alberta, that's about 41% today, about $17 billion. There are other provinces, namely Ontario and Quebec, that are getting very close to 50% of their provincial spending on health. And, that's a problem for a number of reasons. One is that our population is growing, our population is aging, the prevalence of chronic disease is increasing, as is the complexity of dealing with that chronic disease. And so healthcare costs are continuing to grow above the rate of revenue growth in any province across Canada. But it's also an issue for another very important reason, and something that certainly has worried me over the years, because the day one of the provinces hits 50% of the provincial budget going to healthcare is the day that healthcare, the system that we all treasure so greatly, becomes an opportunity cost for education, for infrastructure, for the environment, for other very important public policy priorities that have a very direct impact on the quality of life we enjoy in our province. And in fact, many of these affect the social determinants of health, upon which the health status, the overall health status of present and future generations depends. So we've invested a lot of time in Canada talking about the money, and I think that serves a purpose. But the other side of the coin, of course, is the demand side of the equation. What we are doing in public health care in order to promote better health status of our population over time. And as doctors, you would know this better than me, and you probably have worried about it for a lot longer than before I heard about it. But this is, in fact, the first generation of Canadian children to have a lower life expectancy than the generation that preceded it. And so we also have a responsibility when we consider investments in public health care to think about that fact and to think very carefully about what we're doing and what we're investing today in order to change that trajectory. And as I said, you know better than I what the picture is for chronic disease in Alberta and across the country. So that perspective about improving the health status of our own people for this generation and for generations to come is really the basis of our government's emphasis on primary health care. It is not and was never intended as a debate of the merits of one service delivery model over another service delivery model. It was an attempt to address what Albertans have been telling successive governments in this province for many, many years, and you may have experienced this as a doctor. And all of that is not a testament to government. I don't offer it as a testament to government, but I offer it as a testament to our ability to have had the resources to make these choices. What we're saying to health professionals and what we're saying to Albertans is that that's well and good and as it should be, and we'll continue that. But we need to pay attention to the foundational elements of public health care that actually drive what the health status will be of our own people. And for me as minister, when I made the decision to run and when I was fortunate enough to have this opportunity, I decided that my focus, at least initially, would be on those building blocks: primary health care, continuing care, and mental health. And I would hope you would agree that when you look back on some of the decisions and some of the initiatives that have been made in the last year, outside of the frustration that I know you're feeling with negotiations, you will have seen investments in these areas and real action. I can tell you that we have set aside for the next 3 years $100 million to support primary health care and mental health, about a 75-25 split. We have revised completely the decision-making process within government as it pertains to the social policy arena, so human services, education, health, and justice are working together in new ways. They're developing government policy together from the get-go at the foundational level. We have an early childhood development strategy in this province. We have a social policy framework for Alberta that is nearing completion. And we have an early childhood development strategy that is a cross-government strategy that is going to drive in the next few years tremendous increases in resources for maternal and child health and for infant screening. And I think many of you know about the work we've been doing in this regard. So we have really dedicated ourselves, using I think, ultimately primary health care as the platform to trying to make a real difference in the health status of current and future Albertans. And in doing so, we've had to pay careful attention to not only how much money we're spending on health in Alberta, but where we're making those investments. So that is the perspective of the government when it comes to the healthcare system broadly. And I offer this not because I expect you to necessarily understand or agree or necessarily care. I'm not sure how much of what I'm telling you really has an effect on your ability to deliver the quality of care that you wish to deliver to your patients. But I am telling you because it is a signal of the direction that we intend to pursue and the strength of the commitment that we have. Now, I happen to believe that we have the support of Alberta physicians in these endeavors, not at the expense of issues in the acute care system. And before I forget to do this, I want to take a moment to thank you as physicians for the contributions that you have made, the huge contributions and personal sacrifices to achieve improvements in acute care occupancy in the last few months, and in the reduction of alternate level of care patients in our acute care beds. I know about the work that you have done. I thought very carefully about these requests before they were made, and I spent a lot of time talking with Alberta Health Services, not just senior management, but talking with physicians that I knew about what the issues are and what the impact might be of setting a goal. Not to be punitive, not to drive, taking away resources from people, but to actually focus us on a very specific problem that drives our ability to deliver access and to deliver quality and safety. And you have made some tremendous progress working together with other health professionals on a site-by-site basis. And I know there's certainly a way to go in the future, and the numbers are not the story. The story is the innovation and the collaboration that's gone on at the site-based level, particularly in our 7 large acute care hospitals in Alberta. So I want to take a moment to thank and applaud your efforts for that. So that's a bit about the perspective that I bring to the job and the things that the Premier and I talk about when it comes to health care, and the things that my Cabinet colleagues and I have collective responsibility for. And we can, tonight is probably not the night to finish the speech that I originally brought you because of the other issue and of course the elephant in the room in negotiations. But I did want to make those few points initially to try to bring this to a human level. So I want to take a few minutes to talk about where we are with respect to the negotiations. Again, from the government point of view, the presumption is that we will ultimately have an agreement. But there is also a recognition, and Dr. Giuffre also addressed this in his remarks, that we have had, you have been down a very difficult journey, and predecessor ministers as well before me have been on this journey with you. We are now almost 20 months without an agreement between the AMA and physicians in the province, and we could spend the rest of the evening talking or perhaps debating about why that might be the case. And I would, perhaps unlike Dr. Giuffre, I would suggest to you, with all due respect, that I think there's plenty of responsibility to be shared on all sides for that situation. But I would also remind you, with the greatest respect, that we do live in a province that has fortunately had the resources to invest in physician compensation and supports for physicians that is second to none across the country. And that is not offered as a suggestion that I believe, or the government believes, that we're paying our doctors too much. We believe that we have the best doctors in Canada, and that one of the reasons that we do is because we have been able to offer the best compensation in the country. And we believe that has been a factor in the recruitment and retention of our physician workforce, just as you have been a critical factor in recruitment and retention by being the mentors, by being the coaches, by being the examples of what practice in medicine can be in this great province, whether you're working in acute care or primary health care, whether or not you're involved in teaching and research in an integrated environment, or whether you're focused just on clinical service delivery. So I want to say that, you know, our perspective is that responsibility for where we are today is shared. In terms of the, you know, positions on the issues, that's important, and I'm not going to discuss that in detail in front of the media. I leave that to you to discuss with your leadership, and for your leadership to represent those perspectives when your leadership is meeting with me and with my officials. But what I will tell you is I think we have a tremendous opportunity in front of us to reach an agreement, but it has to be based on the recognition of some critical facts, some issues that are in front of us, the elephants in the room that we need to deal with. First of all, and I want to correct a number of misperceptions or misinformation that appears to be out there. So first of all, my decision last week was a very difficult decision. I can assure you I did not make it lightly. I see a number of faces in the room that I recognize, people that I have known in my previous work in the healthcare file. And I am absolutely as exasperated as you are at our lack of progress on an agreement. But the reality is that the fiscal position of this province has changed. Today we are facing a projected $3 billion deficit for this year. We are not seeing the improvement in energy revenues that we were hoping for. In the midst of all of the downside on revenue for the province, we are seeing people now continuing to flock to Alberta as provinces in the east face much more serious economic difficulties than us. Our population is growing, it's aging, the prevalence of chronic disease is rising. The health status of Albertans is somewhat improving, but we still, as you know, we still face very high rates of chronic disease and many, many more patients who have multiple chronic diseases. And we have some fiscal imperatives in other areas beyond healthcare. And so when I told the AMA president that I wanted to present our best financial offer to the Alberta Medical Association, I actually meant that. I actually felt that it was my responsibility to be clear about the maximum number of new dollars, and we can talk about the math and how it affects people, and I'll address that in a minute. But I actually felt I had a responsibility to be clear about the maximum amount of additional taxpayer dollars that would be available. That said, there is certainly an opportunity to talk about how those dollars are allocated, and I believe that that should be a collaborative process. But number one is that there is a reality around the total number of dollars that are available, and I need you to know that, and somehow we have to find a way to work with that, despite what other expectations that people may have. So that was actually an upfront statement. It wasn't a positioning tactic whatsoever. The second issue that I want to clear up is that the business cost program and the retention benefit program, which total about $120 million, are most certainly available for compensation for family physicians. I've talked to a number of family doctors, and I'm sure there are many here tonight. I'm not sure that a lot of family doctors feel very great that two ancillary programs that are not part of the fee schedule, that were developed in a previous economic climate in this province, when overhead costs were higher, when other healthcare settlements were offering retention benefits for people who work in other disciplines. I'm not so sure how family doctors feel about just a perpetual reliance on those programs rather than an honest look and a close look and a collaborative look at what compensation for family physicians needs to look like in 2012, recognizing that group is becoming an increasingly important part of the healthcare system. So I have never said, and I want to be clear about this today, that $120 million is not available for compensation for our family doctors. The question, the more complicated and the more difficult question, sometimes people don't want to deal with difficult and complex, but what is the better way? What are the opportunities to compensate family physicians, not only more fairly, but more appropriately to recognize the complexity of the work that you're doing today? So that myth I'm hoping can be off the table as of tonight. And that is one of the issues that I think we need to focus very carefully on in the upcoming discussions. And if it is the will of family physicians of this province that the AMA represent them in those discussions and speak to their needs and their aspirations and so on, then I completely accept that as the Minister of Health. I have absolutely no interest, and I don't think you do either as an association, in having me deal separately with the different sections of the AMA when it comes to negotiations. It's not productive, it's not interest-based, and it doesn't lead to a fulsome discussion about outcomes in the system. The second thing, the second elephant in the room that we do have to deal with, and I'm going to be very honest with you about this, is this question about how we approach disparity in fees among the different specialties. And there are a lot of people in this province over the years, in the physician world and in government, who have put a lot of time and expertise into trying to tackle this issue. But the reality is that we have not dealt with it. We have some of the greatest disparities in compensation for physicians that you will find anywhere in the country. And I'm not going to name any specific fee codes, and I'm not going to talk about individual specialists, because this is not about targeting specific specialists in their field. This is about talking about how we take a province that is in the position of, on average, paying 29% more than the national average to our doctors, and how we do a better job of allocating those resources within the compensation envelope in order to be fair, to recognize things like the impact of technology, and ultimately, of course, to use that $2.7 billion, which is the value of just the fee-for-service as an example, fee-for-service and ARP, to drive some different health outcomes in our system that will result in better health for Albertans. I'm sure you would agree with me, particularly of those of you that are operating your own practice and that are making investments in overhead and have other expenses, that you make strategic decisions about your investments in technology, about the protocols that you use in your practice, about how you choose to apply evidence that is coming at you every day from all quarters, be it a new drug, be it a new diagnostic imaging technology, be it a new electronic medical record to run your office with. So those are strategic decisions that need to be made. And it is my view, and it has been my position throughout these negotiations, that we need to work jointly on the development of a relative value guide, if that is what we agree is the most appropriate process, or some other alternate process to do the job that needs to be done of reviewing fee equity in physician compensation. It has to happen, ladies and gentlemen. It is not something, I assure you, that the government wants to do alone. It's not something I want to do alone. But it has to happen, and it has to start now. And so we have had some, I think, very constructive discussions in the negotiations on this point. And we've had, you have some expertise in the staff of your association and in your membership. We have some expertise, and we were very close to what I think was an agreed methodology. Now, to those of you who feel that you've been told that a particular fee code or codes that you depend on are being unilaterally cut, that is not the case. I have never said that, and I will not say that. What we did do was we did look at, and we did provide a list, which obviously has been shared with all of you, of the fee codes that are most misaligned in the entire schedule of medical benefits. And again, I'm not going to get into talking about individual specialties. I have a feeling that some of you know what those are. And we brought those forward in the negotiations as a separate group, because leaving those unaddressed results in a multiplier effect that on a year-over-year basis is hundreds of millions of dollars in additional cost. So we believe, and you know, this is certainly open to discussion, that there is in the short term, there's a group of fee codes that need to be looked at more urgently because they are a cost driver, a huge cost driver. And then, of course, more broadly, we need to look at the entire fee schedule, and that, of course, is a multi-year process. So no one, including this minister, wants to make unilateral decisions about adjustments to those fee codes. Notwithstanding what happened in Ontario, and not whatever motives you are attributing or maybe being encouraged to attribute to myself or to the government. That is not the question. But that issue must be dealt with, and we must find a way in these negotiations to do that. One of the reasons I made the decision that I did, and this isn't offered as a criticism or reflection on anyone, current or past president or board or anybody else, is that I felt that we weren't facing up to that issue. For whatever reason, and again, it is the purpose of the AMA to represent the interests of its members, financial interests of its members, the discussions kept coming back to more money and to a discussion of global rate increases, which I know are important and have been the highlight of your discussions in the past. The system in the past had always been that we agreed on global rate increases, and then internally you used your processes with RepForm to do the allocation. And that, simply relying on that alone, cannot continue. And if I allow the negotiations to only dwell on the question of how much additional money is going to be thrown in the pot this year, I put you and I put government and I put taxpayers in the position of compounding a problem that we still have not dealt with, which is that question of fee equity. So this is a big issue, and it is something that I wanted to speak at length about tonight, because I'm hoping it will clarify some of the things that you know, or that you think you know, or information that's been presented to you. So I'll end where Dr. Giuffre did, and that's the question of how do we move forward in these discussions. I certainly agree that it starts with respect. And one of the more difficult things for me coming in as Minister of Health was to have to acknowledge, and I still have to acknowledge, and I'll continue to, the fact that there were very, very abrupt changes in the structure of the delivery system in Alberta, and that they impacted you greatly. They also impacted many other health professionals, and they impacted the support workers. It was done very quickly. It was done with very little consultation. And once it had been done, there were some pretty serious twists and turns along the way that you experienced that created a very confusing, I'm sure, and difficult environment within which to work. I think we've come a long way in dealing with that, but I think I will continue to have the responsibility to acknowledge that as we move ahead. And I'm very proud and I'm very excited every day when I go to work and I hear about the work that you are doing in areas like strategic clinical networks, in the fact that you're developing clinical pathways in areas like depression and lung cancer, and that we have the ability now in our province to apply those when they've been developed, when they've been endorsed by our clinicians, and when they've been shown to be supported by the evidence. We have the ability to deploy those for the benefit of every one of our citizens who might be so unfortunate as to develop lung cancer or as to develop depression or a mental illness. So there is, I believe, some cohesion that is building. I can't speak for what it's like to be a staff physician in Alberta Health Services. What I hear tells me we still have a long way to go in terms of physician engagement. And, ladies and gentlemen, I can only do so much as one person to try to affect that change. That goes to the question of culture. When we talk about how we make this different, I think we're talking about issues involving leadership, involving a willingness of people to meaningfully engage, and involving a willingness of people to be trusted and to trust one and to trust others. So I don't for a minute dismiss the disruption that you have been through in the last number of years, and I certainly feel badly for those people who were negatively affected. But you know what? We've come through that change, and no, everything isn't all right yet, and we have a long way to go. But we have come through the change, and I stand by my original commitment to this province when I was appointed. This government is not going to restructure or reorganize or otherwise disrupt the delivery system in the province. So you have my word on that. Does that mean that we won't explore new avenues in service delivery, like family care clinics, as well as enhancing our primary care networks? Of course it doesn't. In the same way that it doesn't mean we'll continue to try to find new clinical pathways or develop protocols for use in treating chronic disease, because we know they work, and we know we can be more efficient when we apply them. It doesn't mean that we will stop looking for opportunities to use your colleagues in other health disciplines, not to substitute for the critical role you play, but to better support you in the role that you play, and to avoid situations where you do not get the opportunity to use the full extent of your training and experience and expertise, and for your very scarce and very highly valued skills to be applied to the most complex problems in healthcare, not the simplest day-to-day issues. So going forward, in terms of the negotiations, we need to be prepared to talk about all of these issues. I have a formal communication from Dr. Giuffre to which I will be responding in due course. We need to move forward, but we need to do so with the acknowledgement that the total amount of additional dollars, that there is a limit to what we can afford, and I can only trust people to believe that the government is up front with them. To even assemble the $463 million, I can't begin to tell you what I had to ask of my cabinet colleagues in other areas, like education, like human services, that also have an urgent need for these resources. So I would hope that when we go back, and I believe that we're going to go back, that it won't start with a discussion about global rate increases and what people's expectations are. The AMA has said consistently to me that they want to talk about outcomes in the healthcare system, and I'm prepared to do that. So that's number one. Number two, we need to move on to this question of how we use $120 million to better compensate and support our family doctors. If you're looking for me to stand up here and say, I'm going to commit to you that every one of those $120 million are going to go, excuse the sort of crass nature of the comment, but in people's pockets, I'm not going to say that. I want to have the discussion about what is the appropriate balance between compensation, what are the right models, what are the supports that people don't have that they need in order to allow them to be more productive, and how do we accommodate those of you who are family physicians who have said to us, and there are quite a few, that we would like to look at alternatives to fee-for-service. We would like to look at opportunities for salary-based or hourly-based or combinations of the two. There has to be room for that discussion. And if you want me to work with your association as your representative in those discussions, and you tell me that, I will respect that, but I will hold you to that word because I will be dealing with your association on that matter. And then the third area is this area of fee equity or resolving these disparities. It's the big thing that we haven't done yet. And I think that the reason we haven't done it is not because people don't agree it's an issue. It's because we've been fortunate enough to have the financial resources just to look at the issue of what's the increase this year? What's the global increase? Not how are we allocating that increase and investing it? And I don't want to do that job alone. And I can't do that job alone. And if I try to, it will not be successful. But I have a responsibility to make sure that we don't put that task off. So I'm here tonight to I guess in wrapping up, to say thank you. I really, despite what some of you said to me, I really didn't have any second thoughts about coming. I believe I'll go home being glad that I did. I will be responding to Dr. Giuffre. But, bottom line for me, there's only one side to be on in this discussion that we need to have with our physicians. And you know it as well as I, and that's the side of the patient. I believe that you're there. I believe that you not only care about the people who are sick today, but about the health of your children and grandchildren and future generations of Albertans. I believe that you believe you have a direct role in influencing what that health will be in the future for the people of the province. And we will, as I said, Dr. Giuffre and I, we will complete our discussion and do what we need to do. I'm not going to get into the details of that tonight, but I do thank you for the invitation, and I hope that some of what I've said has shed some light on the issues that I know you're concerned about. Thank you.